Hi, my name's Andrea. I'm a level 1 nursing student. I was wondering if you could give me a SPAR report on your patient, please.
Yes, I have room 529. It's Marta Yarn. She's an 80-year-old female with no known allergies. She's a full code and she has Dr. S. Jolly. She's admitted for a non-healing sacral ulcer for 3 months. She's been treated as outpatient with no success. She was admitted from the doctor's office. She's alert and oriented ×4 and complains of generalized weakness. Her pupils are equal, round, and reactive to light and accommodation. Her gait is coordinated but slow and uses a walker. Her chest expansion is symmetric, and she's got clear lungs and all fields. Her anterior and posterior are diminished in bases. She's sinus rhythm with premature beats and vitals every 4 hours. Her abdomen is soft, non-distended, non-tender, slightly obese, no masses, and her bowel sounds are present in all 4 quadrants. She has no lesions or inflammation in her perineal area, and she's scheduled for debridement in the morning. Her blood pressure was 144/90, pulse of 88, respiratory rate of 24, temperature of 99.1, and pulse ox of 92%. She has a stage 3 sacral wound. It's 4 centimeters by 4 centimeters by 1 centimeter. It has involvement of surrounding tissue, and it's kidney-shaped, serious exudate without unusual odor, no undermining, tunneling, or bruising. Poor skin turgor. She's got a 20 gauge in the right dorsal metacarpal. And we're going to give gentamicin and sodium chloride with potassium today for the infection because it was positive for E. coli.
Okay. I have some questions. Why specifically is this client receiving this medication?
The client's receiving the medication for her elevated white blood cell count and positive E. coli.
And what action does the medication have on the body?
It inhibits protein synthesis through irreversible binding to the 30S ribosomal subunit of susceptible bacteria.
This one I have a few questions.
Okay.
When should you question administering this medication? Does it have a therapeutic serum level? And what vital signs and physiological parameters should be monitored?
You should question administering to clients with renal impairment, renal failure, or renal disease, hypersensitivity, hearing impairment, neuromuscular disease, pregnancy, or neonates. The therapeutic serum level is 0.5 to 2 micrograms a milliliter with a peak at 5 to 10 micrograms a milliliter. You should monitor vitals, hearing, serum, aminoglycosides concentrations, serum creatinine, and BUN.
What interventions must be taught to the client to ensure that the medication is administered safely in the hospital setting and or at home?
I would advise client of the side effects of the medications and what to report to the physician.
What are the side effects and potential adverse reactions?
The side effects are ototoxicity, neurotoxicity, rash, itching, decreased appetite, weight loss, and respiratory rate depression.
And how will you know that the medication is effective?
When the client no longer has signs and symptoms of infection and the lab values are normal.
Okay.
So I'm going to check them all, and we're going to give the gentamicin and the sodium chloride with potassium. So I'm going to pull that out of the Pyxis. Now I'm going to check to make sure that it's the right medications. I'm going to check the patient's allergies. I'm going to make sure that the drugs are compatible. I'm going to make sure that it's the right dose, the right route, the right time. I'm going to check the color of the fluid. I'm going to check the expiration date, it's not leaking. I'm going to check this one for the expiration date, the color, it's not leaking. So now I'm going to go in.
Okay.
Knock knock. Can I get your name and date of birth?
Sure, it is Marta Yarn, and I am 80 years old.
Do you have any allergies?
Nope.
So today I'm going to give you the sodium chloride with potassium and then an antibiotic called gentamicin.
Okay.
Do you know why you're receiving this medication?
No.
So you're receiving it because you came back positive for E. coli.
Okay.
Alright, I'm gonna give you your call right here and make sure you guys down all the way.
Do you know some of the symptoms you should look out for while you're getting the medication that you should notify us about?
Like a rash?
Yes. So rash, itchiness, trouble breathing. I printed out something for you so you can look at it. It gets more in depth.
Okay, thank you.
And right before we leave, we always wanna make sure that we're gonna label our tubing, and we've got labels on here, we label
So I'm gonna check your
date
IV.
and initials because
Is it okay that I give you this medication? Because you can refuse.
Sure is.
Okay.
are done.
So I'm gonna clean the IV site for 15 seconds.
Good to go. Alright, we'll see you later.
Any burning or anything?
Nope.
I don't see any swelling.
Any questions for me?
Yeah, I did. Were there any pertinent pieces of information you reviewed before administering the client's medication?
Yeah, we looked
So
at
now I'm
it.
gonna recheck
What was
for the sodium chloride with potassium, 20 milliequivalents, and 1,000 ml. I'm gonna recheck the patient's allergies,
Issues.
make sure it's the right medication, the right dose, the right route, and the right time, which it is,
Okay.
and the color
did
of the
this
bag and
information affect
everything.
your decision to administer the medication?
Well, yeah, well, we found out that she had some renal injury, and we did one of our issues, but she was dosed for those. And then her, of course, was her last week, and she just showed signs for infection, so we wanted to make sure we got her started on an antibiotic.
Okay. And did this information affect how you administered the medication?
Well, we administered it just as it was ordered, so, no, not really.
All right, well, thank you.
So I'm gonna scan the patient's ID.
You may want to look this over. This thing kept shutting off, shutting off, shutting
It's
off.
because you kept
I'm gonna
when it
scan the
did,
medication.
instead of going back to your camera, so you were taking pictures of
Oh,
me.
I did once. No, I did once, but it keeps
I'm gonna
reminding me
prime the
to get a
tubing.
message that says your storage is full. Sure. You don't have to say yes if you really want to go somewhere else. Or is he going to and how that's good. Okay. Did it get it? Even if you delete them, if you don't empty the trash.
So how many times, how many videos?
Probably about 10. I mean,
Alright, then I'll have to do that again. I didn't think it was going on that much.
yeah. It's just constant.
So is this a new
If
patient?
you're not paying attention to that, you know.
No.
Did it work?
So I'm gonna channel select guardrail IV fluids, giving 0.9% normal saline with potassium 20 milliequivalents.
At a certain time, like 5 o'clock or something?
The rate is gonna be 125, and I'm gonna do 950 so the line doesn't run dry. So now I'm making neck
I
this.
just want us all to get it done, so if you wanna do it, I'll be here. You done with this now?
I'm gonna hit start.
Go home and do one. You know, you can just put in the numbers, right? You can do the purchase and all of this.
Wait, so it didn't require it?
It recorded in 1,000 pieces.
It's cause I didn't have the storage set.
So I watched the 5 drops of the medication. And then now I'm going to give the gentamicin. So I'm going to recheck and make sure that it's for the right patient, it's the right medication, it's the right dose, the right route, and the right time. So now I'm going to scan the patient's bracelet again. Scan the medication.
Just go down to duration to 1 hour and then
I'm going to prime the tubing.
And I can do it. She can go if she wants to. We're very good at 2 people video.
So I prime the tubing.
You're gonna have to find somebody who wants to.
And I'll go on this first. I'm going to clean the tubing for 15 seconds. So now I'm going to hit channel select, I'm going to hit secondary, and then I'm going to go down to gentamicin. I'm going to give it's 80 milligrams and 100 mLs. So I'm going to make sure that this is correct, which it is. So I'm going to hit next. I'm going to unclamp this. Hit start. So now I'm going to label the tubing with my initials and time change and what the medication is. And watch for the 5 drops. And then I'm going to just label the other tubing with what it is in my initials, and then you should change the tubing. You have your call light and everything?
Yep.
Okay. And you know to call us if you have any symptoms or anything.
Yes.
Okay. Do you have any questions?
I sure do. Were there any pertinent pieces of information you reviewed before administering the client this medication?
Yes, I reviewed the allergies, the 5 patient rights, the drug compatibility, and the labs.
Did this information affect your decision to administer the medication?
No, because everything was correct, so I was able to administer it.
Okay. Did the information affect how you administered the medication?
No, everything was correct, so I was able to administer it correctly.
Okay, thank you.
Mm-hmm.